Senator, thanks for being here today. I appreciate that. I've reviewed 3,200 best I could. To me, it is obviously written with the assumption that government has the right to control our lives from pre-birth to death. For that reason, it's not worth considering, it's not worth modifying, it's not worth amending. It needs to be dumped totally. I believe the polls show that most people are happy with their health care. There's a few problems. The illegals. They shouldn't even be here, let alone us have to cover them. I would ask Congress to do something to send them home so we don't have to deal with that. There are people who don't want to pay for coverage. Then let them pay for the service when they get the service. We shouldn't have to provide for that. There are some people who are both evidently, they would like to have care, they're unable. President Bush used to say, help those who can't help themselves. Let's focus on those minor problems. Let's focus on tort reform. Let's focus on helping people carry their coverage over to a new job. But leave us alone. That's all we would ask. Would you leave us alone? I would like to ask you today if you would commit to working on those problems rather than throwing everything into turmoil. That would be my request.
Well, would I commit to working on those problems and not throwing everything into turmoil? That's a pretty generalized statement that I can agree with. Stay in touch. I'll be back next year, but if I'm reelected, I'll be back the year after that. who has number 7?
Thank you for coming, Arlen Specter. I appreciate it.
Well, let me answer more fully. I don't want to see turmoil. You don't want to see turmoil. We want to have a sensible answer. We have a series of problems. And we want to take them up one by one. And we want to figure out what the problem is and what is the way that we should deal with them in a democracy.
How about 3,400? How about 3,400? Are you familiar with that, sir?
Not familiar with 3,400. Let me move on to number 7.
Thank you. I am a Republican, but first and foremost, I'm a conservative. I don't believe this is just about health care. It's not about TARP. It's not about left and right. This is about the systematic dismantling of this country. I'm only 35 years old. I have never been interested in politics. You have awakened the sleeping giant. We are tired of this. This is why everybody in this room is so ticked off. I don't want this country turning into Russia, turning into a socialized country. My question for you is, what are you going to do to restore this country back to what our founders created according to the Constitution?
Well, there are a few people who didn't stand up and applaud, but not too many. I get a fairly firm message from the support you have, young lady. When you ask me to defend the Constitution, that's what I've been doing. We've had warrantless wiretaps that I have objected to. We've had signing statements that undercut what the legislature has passed. We've had Supreme Court nominees whom I have insisted follow the Constitution and not make law. But in our social compact, we have provision to see to it that we take care of people who need some help.
But the good hearts of the people will do that, not the government.
And we have many people who are in need of assistance on health care. I have a number of people with me today who have very tragic stories to tell about their own situation. But we want to maintain constitutional law, and I'm committed to do that.
Senator
22?
Specter.
Yes, ma'am. Number 22.
Section 1233 of the proposed health care plan. I thought, what could I possibly ask you to make you read this plan? What it says is, as a 74-year-old man, if you develop cancer, we're pretty much going to write you off because you're no longer a working citizen who will be paying taxes. What are you going to do about it? You're here because of the plan we have now.
Well, you're just not right. Nobody 74 is going to be written off because they have cancer. That's a vicious, malicious, untrue rumor. Who's got the next number? Who's got the next number?
You can feel the tension in this room. You can understand that these people are upset. Why don't you do this? Why don't you let us know who's writing these bills, seeing as how you don't have time to read them? Why, and don't take that the wrong way, please. Why don't you let us know what their political affiliations are? Why don't you let us know whose feet they sat at and learned politics from? Why don't you make that public? And why don't you do this, please? If you guys think that we want health care reform so bad, do this. Let's have a referendum in 210. We'll tell you if we like your plan or not. How's that work?
Well, that's a fascinating idea to have a referendum. We don't have any mechanism for it on the federal government. They have them in California.
Make it happen. You haven't got a bill yet in the Senate, right? You can start it. You've got voting machines.
Well, that's one of the ideas I'm going to take back to Washington, a referendum.